Hello, everyone. I am Rahel Nardos, the Director of Global Women's Health at the Center for Global Health and Social Responsibility and Associate Professor in the Division of Urogynecology and Reconstructive Pelvic Surgery at the University of Minnesota. I'll be moderating today's webinar. We are excited to have you here today in our annual International Women's Day event, where we will be discussing a topic that is near and dear to my heart, innovation in global women's health. Here at the Center for Global Health and Social Responsibility, our Global Women's Health Initiative is involved in some truly exciting projects that are transforming women's health through innovation, research, training, and advocacy. We do this work through collaboration with various institutes and centers at the University of Minnesota and partners globally. And some of our exciting initiatives include building a safe C-section simulation training platform to improve surgical safety, teamwork, and compassionate patient care in order to reduce maternal mortality and morbidity globally, working on surgical device innovation to provide affordable, safe, and environmentally sustainable options for pelvic floor surgeons in low-resource settings, and building digital platform for patient-driven and accessible holistic mind-body intervention for women with bladder and pelvic floor disorders. Through this innovative initiatives, our goal is to ensure that every woman has a shot at achieving her full potential, no matter the lottery of her birth. Because when women do well, we all do well. So we're very fortunate to have this incredible speakers for this conversation today. And I would like to briefly introduce our panelists before we get started on today's program. So Rashmi Kandwal is the Executive Director of Healthcare Minnesota, where she drives strategy, fosters collaboration, and builds impactful programs that empower healthcare entrepreneurs and innovators across the state of Minnesota. She's passionate about bridging connections and amplifying voices in the health industry. Rashmi also co-hosts the Patient Innovations podcast and serves as on the board of Roundtable RX. Our next panelist is Madeline Wieland. She graduated from the University of Minnesota with a master's degree in mechanical engineering. During her graduate school program, Madeline participated in a year-long course called New Product Design and Business Development, during which time she, along with a team of graduate students, worked with me and the course director, Dr. Isles, to design a new surgical tool to treat pelvic organ prolapse in low-resource settings. Madeline currently works with Boston Scientific as a manufacturing engineer. Welcome, Madeline. Last but not least, Iyaduni Olubode has over 20 years of experience across the private and development sectors in Nigeria. She's a fierce advocate for women and youth as key contributors to the economy. She has led MSD for Mothers program in Nigeria since 2018 and recently took up similar responsibility for programs in Kenya. MSD for Mothers is a $650 million initiative to create a world where no mother dies while giving birth. Before MSD for Mothers, Iyaduni was executive director of Leap Africa, a nonprofit focused on leadership development for youth and entrepreneurs. So I'd like to thank all of our speakers for taking the time to join us today and share their expertise. We're incredibly grateful for you. During this session, I just want to remind the audience that you can submit questions that you may have during the presentation in the Q&A section at the bottom of your Zoom screen. We will have a Q&A session at the end of the event where we will try to get to as many of your questions as we can. The chat box will not be available for you to put comments, but we will be communicating through the chat box with you about certain access to certain resources that you might find helpful. So let's get started. So to set the stage, I'm going to ask each of our panelists to briefly define what innovation means in the context of women's health and how your work contributes to advancing health equity through innovation. And I'll start with you, Rashmi.
Thank you, Rahel. First of all, so glad and excited to be here today. Um, I would absolutely love to add my perspective to how women's health and innovation in contact, like talking about innovation in women's health. I think where I want to begin is by saying that all of us, first of all, need to understand that we need to fundamentally rethink what we have done before this in this space. So that's where I want to start with. And having said that, I think innovation in women health means designing solutions that cater to specific and very unique need that women have and the challenges that they face. And across healthcare systems, treatments, technologies that we are building, we need to recognize that historically these have been very male centered. So some rethinking need to be done there as well. It also means creating inclusive medical research, clinical trial platforms where women and men both are adequately represented. It also means when we are designing new devices, new technologies, we always have these gender specific rules included. And also promoting healthcare practices that reflect women's experiences and needs. So, having set that stage, I think through my work at Healthcare Man and the podcast Patient Innovations, what we are doing is we are focused on three pillars. The first is creating an accessible and an affordable platform where we can help those who are innovating in healthcare. The second piece we are working on is amplifying voices of patients, of clinicians, of founders, investors, and we bring them and spotlight innovations that they are working on. And the third piece, and the most important piece, I think, is creating connections and giving everyone a platform for conversations. We want to bring all the stakeholders together on one table, and in making and doing that, I think we always make sure that women are well represented when we are doing that. um, we host a lot of events throughout the year. We put together pitch events, forums, and whenever we are doing those events, we are very mindful that we have that representation. So I distinctly remember we were putting together an event 2 years back, and we were doing a speaker panel. We needed three speakers, and we had five male speakers confirmed. So we could have gone ahead and done that, but we took a step back. We waited and talked with more women innovators that we wanted to showcase. So we are always mindful of those things. And on the other side, with the Patient Innovations podcast, we bring together the patients and researchers. So every month, me and my co-host, we sit down together and we talk about a health condition. And for each health condition, we bring three guests for each episode. So there is always a patient who has that health condition. There are physicians who are treating those health conditions, and the third guest is always either a research organization, a foundation, or a founder working in that space. So then we talk about real lived experiences, real life, how that's happening, what are the challenges that are happening. And we are hoping that we can share these stories. So storytelling is an important part when it comes to women health as well. And we can also show that 360 perspective from the patient perspective, physician, and the organizations that are working in that space. So bringing that and highlighting that collaboration. And we know maternal health is so important. So this year we have purposefully included more topics on maternal health, and we are trying to talk about specific health issues that women face, like PCOS, endometriosis. So we are designing our podcast episodes around that as well.
Fantastic. It's so critical to have an organization like yours, that provides that kind of platform for collaboration. And we will be coming to, I'll be asking some questions around that later in the panel discussion as well. Madeline, what are your, input into this definition of innovation in your mind?
Yeah, thank you also. I'm so honored to be able to be a part of this panel. I'm so excited to be able to discuss this with such a phenomenal group of women. So I'm thrilled to be here. So thank you. I think for myself, coming from a engineering perspective, a very, very like technical perspective, I have found that innovation and where it is the most value added is from continuous improvement. So I feel like when I was a young engineer back in college and I was really up and coming and you're always so curious about like, oh, what's the next big thing? What's the next big invention gonna be? But really, like, those things come along so infrequently, and what really can make a huge difference in lives is making small, continuous improvements to what we already have. And so I'll speak more about this a little bit later in the panel. I'll kind of come back to it, but there's so much opportunity to reshape technology that currently exists for new contexts where it's not currently being applied, right? So how can we widen the patient pool of technologies that already exist to encompass more women across the globe, right? This is a global conversation, right? So how can we make sure that not only are women getting what they need, but all women are getting what they need? So I think that comes from continuous improvement, which is really wonderful. And then I think in addition to that, one of the things so I work for Boston Scientific, a global corporation, and one of the things that I found working in like a global corporation setting is a lot of this innovation and continuous improvement is incredibly important when viewed through the eyes of diverse leadership. So the more diverse leadership we have in companies like this, both for-profit, nonprofit, academic, the more diversity we have in that leadership, the more viewpoints we get advocating for projects that are a little bit more of the continuous improvement and widening the patient pool and widening the context that we can serve, and a little less narrow-minded if everybody's coming from the exact same breadth of experiences. So it's really wonderful to be able to see diverse leadership being able to support women's health in that space. And also just recognizing that as in so far as my work, I try very hard on my team to open up space for female engineers to grow and develop so that they can fulfill those leadership roles in the future, as well as just other diverse individuals, right? And so making sure that everybody plays a part in making sure there is space for people who will provide those diverse perspectives and be able to advocate for interesting, global, helpful projects that maybe not everybody would look at as important or as value added in the same way. So, yeah, that I think is my answer on innovation.
And so wisely said, Madeline. It's incredible. Everything that you said really resonates with me. And I think that's kind of what I learned actually in my work collaborating with you and your team and the engineering team, because I'm coming from a clinical background and global health background. But how do you, when you have a diverse team like that with an engineering brain and a business brain and a technology brain, it just good things can happen. And I really do appreciate what you said about small improvements on existing technologies. So even the way we present them can be an innovative, so that's a really great point that you make. Yeah, Duni, I would love to hear your thoughts on this topic.
Sure thing. It's really nice to hear the definition of innovation from the different panelists, and I agree with them. For me, innovation means doing things differently. It's figuring out a more effective way to get to X, whatever your X is. In this case, X is reducing the number of women that are dying from pregnancy-related causes. globally. Sometimes it's a brand new shiny thing like an AI chatbot or a new medicine that addresses a condition, and other times it's reapplying something that has long existed in a new and unfamiliar way. So I think of innovation as, it could be a product, it could be a process. And I was really pushing for a third P, but I think the third dimension I would like to mention, and I think Madeline alluded to this, is pushing it as a collective vision and globally aligning people, because an innovation is only as good as if it gets out. People think of innovative processes and they design things, but who knows about it? How do you get more people to know about that solution and benefit from it? And I think in the maternal health context, that is really what we're pushing for. Identifying innovative products, processes, ways of doing things, and making sure that everybody everywhere in the world has access to this innovation so that it actually makes a difference in maternal health outcomes globally.
Fantastic. I mean, it's really amazing how complementary all of your inputs have been from different perspectives. Yeah,
Right.
Dunya, I'm gonna stay on you just as a follow-up, since you work so much in maternal health, and as we know, there is so much disparity in maternal health outcome globally, with the biggest burden of maternal death being in low and middle income countries. Some of those countries, like Nigeria, being one of the top countries where that is true. Um, what are some of the biggest gaps that you see in women's healthcare that need urgent attention and innovation today, particularly from your perspective in maternal health?
Wow, gaps. There's so many gaps, and you said it. In with maternal health, the indices show that about 800 women die globally from pregnancy and pregnancy-related causes, and 70% of those deaths happen in low and middle income countries. The 70% of those deaths actually happen in sub-Saharan Africa. Nigeria, where I live, and Kenya, which is another focus country, are not excluded from this scourge of mortality. And when you think about the reasons why women die, there are the causes, the clinical pregnancy, but there's also the decision to seek care, the delay in reaching care, and the delay in receiving, depending on how you dimension it, I would like to look at it from the three delays: the delay in receiving care, the delay in making the decision to access care. So we know that in Nigeria, for example, more women have their children outside of health facilities. More women are choosing to go to what we call sort of like faith-based maternity homes, and they would rather go to these places than go to a health facility where a skilled birth attendant will take that delivery. And we know that that causes negative outcomes, especially when a woman is giving birth and requires additional support, perhaps surgical intervention to have a C-section, perhaps support to ensure if she happens to have postpartum hemorrhage, which is losing blood excessively in the process of giving birth. And so being able to communicate to women the importance of having a skilled birth is a challenge. How do we reach these women? How do we, first of all, understand why they're not having the women in facilities and address those challenges and build their trust so that they're able to come into the facilities. That is one critical challenge. When you think about the second delay, which is around transportation, getting to the health facility, many women are in hard to reach communities. And we know by WHO's standards that when a woman has a complication, she has 2 hours to get to a health facility if she's going to survive, whatever complication it is. It could be PPH. And so how do we ensure that a woman who needs care can get to the care that she needs in enough time? Sometimes you have a woman going from one facility to another. You have delays with getting emergency transport. And so this is another challenge that people are innovating around, just trying to make sure that emergency transport and referrals work. And these are two examples that I would like to share a little bit about the work that our coalitions are doing under the Strengthening Systems for Safer Childbirth initiative. We've been very fortunate to have such an amazing set of coalitions, 6 coalitions. The Strengthening System Initiative is a community-led initiative. It's really targeted at leveraging the native intelligence of people within the environment to strengthen the health systems in order to accelerate action towards reducing maternal mortality. And so with emergency transport, we worked with a coalition led in Kenya by an organization called Rescue.co, who is leveraging technology, toll-free line. People call into that line. They're able to vet local emergency providers because they have these providers tracked on their device. They're sitting in front of a screen. There's someone who's speaking to the woman and triaging and definitely deciding what sort of facility she should go to. They have an understanding of the quality, levels, the levels of care that each of these facilities can provide. And they're directing the closest vehicle to the woman so that the woman has the best chance of reaching the care that she needs in the shortest time. And because they've used this technology, it's amazing results, reducing the time that it takes to get a woman in Nairobi from one point to another, from about 160 minutes to get 94% of the women, pregnant women, to the facilities that they would receive the appropriate care. Over 12,000 women have been served. This is just one thing that is looking at emergency transport and how do you make it efficient? How do you leverage emergency vehicles, ambulances that belong to a broad fleet of people? And how do you make sure that you're using it efficiently to deliver women to the facilities so that they can survive? Perhaps I can share a little bit about another one subsequently.
Thank you so much, Yaduni. I mean, this was incredible, like the work that you guys are doing in addressing those delays of care, the 3 delays to maternal care. Your voice was cutting out, Yaduni, quite a bit during the presentation. We may need to have you maybe turn off your video if it's helpful for your, just in the future, so we can hear you. But I think we heard most of what you said. Thank you so much. I wanted to keep moving forward and maybe direct the next question to Rashmi. As you know, as someone who works with healthcare innovators across the health sector, what cutting edge solutions or emerging trends have you seen or do you see having the most potential impact on women's health? If you have an example of one maybe that you can talk about. And you are muted, Rashmi, so you might want to turn.
Here, I am unmuted now. The emerging trends that we are seeing these days, having worked with innovators, our work mostly focuses here in Minnesota. A lot of digital health tech that's coming up. It's more like telemedicine apps that help people login details, their health stats, and everything. And then there is a lot of femtech where we are using about technologies, apps, and products that support women-specific health conditions, reproductive health, menopause, ovulation, fertility tracking, and all that. And then there is a lot of AI and machine learning happening. For example, I'll actually add two examples. So one app that I have been constantly using for over almost 10 years now, and then another one is an example of. We just with the healthcare MN event in January, we had run a healthcare startup of the year award, and we had asked for nominations from our community. We got 9 nominations, and the one that won is Mom East Solutions. Wonderful product. I just was thinking about it myself, like where were they when I needed it the most? So they have created a bra that has the capacity to warm, and it helps ease the flow of milk. So simple innovation. They have produced it with a local medical device company here, and something much needed though, right? I got mastitis during my breastfeeding journey, so I just can relate it so much with what that innovation would mean for so many other women who are in the same stage, right? And the other innovation I was talking about is a simple app, Ovia, that one of the friends, maybe I don't remember, 10 years back had recommended just for keeping track of your periods. It's just a simple digital health app. It has a calendar. You can track your uh, things that are changing with you, symptoms, and there is a community board where you can talk about, what if this is happening, like is there anyone else, then people chime in. So uh, a simple product again has helped me tracking keeping track of my journey during, not just during fertility, but then they have another feature where they then do OVIA pregnancy. So during my pregnancy, I use that, and then OVIA parenting. So something that I have depended heavily on. So some these are some of the trends that we have been seeing, and it's been just fascinating to interact with everyone who's working in these spaces, and there is some phenomenal work that's happening here in Minnesota.
That's fantastic. I actually was on a panel discussion with the innovator of that breastfeeding bra.
Okay.
I was incredibly inspired by their work. And I too had trouble keeping up with breastfeeding after I returned to work in clinical medicine. And I was wishing I wish I had access to that at that time. It's a really
Exactly
incredible.
my thoughts. Yeah.
Yeah, incredible. So it's great to see those kind of innovations come out of Minnesota, and that your organization is recognizing them and helping propel them forward. Madeline, I'm going to come to you on a similar topic. You worked as a student at the University of Minnesota with me and Dr. Isles on a surgical tool for pelvic organ prolapse innovation project that was, addressing a critical need in low resource settings, that came out of necessity, actually, because some of the tools that we use in the West are very expensive and they're not affordable, and they tend to be disposable, and they are not environmentally friendly. And so a lot of times, those of us like myself who do a lot of education in African countries to train surgeons find it very difficult to have the right tools. And that was kind of how this project evolved. And you played a very critical role in that innovation process. Can you tell us a little bit about this experience, what critical need it was addressing, and really, I'm actually even more interested to know what impact this has on you as a student at the time, and what kind of professional you become going forward.
Yeah, absolutely. Thank you. It's a great question. So yeah, I would say I was really impacted by this, and I really think it shaped my answer to the previous question of shifting my perspective personally from being that young engineer looking for the next big invention into this person who says, okay, how can we make sure we have this tool that exists that's really wonderful, that like people around me can use and benefit from? How do we make sure that the rest of the world is experiencing this, is getting to have access to this? And it was a question that I never even really realized needed to be asked, kind of being someone who's only ever lived in the Midwest. And it was a very big perspective shift of from small town to a global perspective, and that was really phenomenal for me. So I think kind of to come back to the project itself, right? It was, we were looking at a tool that exists, and we were able to interview different doctors who use the tool that exists right now and hear all the positives and negatives about using it. And kind of like you said, actually, typically, I believe, if I remember correctly, you need 4 of these disposable tools usually to complete the procedure. And it is really hard to get these disposable, expensive tools out to places where they're low resource. And so the question is, how can we get women across the world access to this kind of a procedure? And so the way we tackled it from an engineering perspective is we start by understanding the current state, right? So understanding patents, understanding what is going on, interviewing doctors, doing go-sees, right? How can we get out and actually talk to the people who use these? Then it's brainstorming, which comes back to that diversity piece, right? Of if you don't have diverse perspectives in the room when you're brainstorming a new solution, when you're being innovative, you're not really going to get very far, right? You're all just going to kind of talk in circles. And so it was really, really eye-opening as well to have a very diverse group be a part of this brainstorming activity. That's something that, especially growing up in the Midwest, I hadn't really gotten a lot of. And so that was really, really wonderful. And then we got to prototype, and that kind of led us into one of the challenges too that was really eye-opening for me in terms of medical device. I work at a medical device company now, and I still see it as a challenge, and that is manufacturability. And that's something that often gets overlooked, but it's like we kind of think about, oh, okay, these products are one-time use, they're disposable. Why is that, right? Like a lot of it is because it is just really, really hard to manufacture small little components out of metal, and it's so easy to do it out of plastic. And so understanding that gap and being able to brainstorm around how can we solve that little problem that can then feed into solving so many of these bigger problems. And that's kind of where that continuous improvement idea comes from, of like, okay, we have this kind of root issue. How can we improve on the root issue and come up with a way to bring better solutions to other devices?
Very well said, Madeline. And I would also add, part of the challenge, at least that I've seen in innovation in the West, is some of those disposable devices are make more money. I mean, it's, if you use and throw, you will continue to buy those products. Whereas if you have something that you can use and recycle and use and recycle and use, those companies don't make as much money, right? So the economy definitely dictates, which is why there tends to be that disparity in innovation, right? Like, how do we innovate with environmental sustainability in mind? How can we control cost? Because we have such great healthcare cost crisis right now, even in the West, right? Like, how do we strike a good balance of safety and effectiveness of tools while we're also looking out for cost effectiveness and sustainability? It's a big challenge that maybe academic institutions will have a really good role to play, because we have the students and the faculty and the learning excitement around this to kind of drive that change. So thank you for your perspective on this, really. And I'm coming to the last set question to the group here, We know that health innovation often requires collaboration across industries such as healthcare, engineering, policy, business, finance. What are the key ingredients for successful cross-sector partnerships in women's health? And I'm going to start, Yaduni, with you. From your experience in global maternal health, what are some examples of effective public-private partnerships that have led to a real improvement in women's health outcomes? And you are muted as well, Yaduni, if you want to unmute yourself. You are muted, Yaduni.
There we go. Can you hear me
there
now?
you go. I can hear you now. Yeah.
Yes. Thank you very much, Rahel. When I think of successful partnerships, I think of many different things, but I think that what comes to my head as something that is really critical, and Madeleine alluded to that, is collaboration. The whole will always be greater than the sum of its parts. We need to think interdependently. We need to think differently, because clearly the way that we've thought about doing things in the past hasn't worked. And when I want to talk about a partnership that I think really brings to light the power of innovation. This is a partnership that MSD for Mothers entered into with Ferring Pharmaceuticals and WHO. Just to step back a little bit, PPH is the #1 killer of pregnant women. A lot of women, nearly 200 women every day in the world, die from bleeding complications, which is basically PPH, when a woman gives birth and she loses blood. Now, the current standard for care, or the more common standard before this initiative happened, and I think still is, for the prevention of postpartum hemorrhage, is oxytocin. And oxytocin is temperature sensitive. We've seen studies that have been published that show that oxytocin, especially in Nigeria, these studies have shown that it consistently has degraded and lost potency and efficacy due to inadequate storage conditions. You can imagine managing a cold chain, because oxytocin is meant to be stored between 2 degrees and 8 degrees centigrade. You can imagine managing cold chain in our climate, especially with the power challenges. And because of the heat stability of another drug manufactured by Ferring Pharmaceuticals, we thought, okay, there's an opportunity here. So MSD for Mothers, Ferring Pharmaceuticals, and WHO, through a public-private collaboration, worked together to tackle this issue of PPH, preventing PPH and heat degradable, preventing PPH by making sure that there's an option to heat degradable oxytocin. The collaboration began with MSD for Mothers approaching Ferring and WHO about, studying the possibility, doing an investigational study on heat-stable capitocin, which was a product of Ferring, in an effort to see how we could increase the access to this medicine that supposedly can prevent PPH as a uterotonic. And so the Champion trial was launched. It was conducted by WHO in collaboration with UNDP, UNFPA, and it was conducted in 10 countries with nearly 300,000 women, Nigeria inclusive, Kenya inclusive. It's the largest clinical trial in preventing the prevention of PPH. It was double-blind, it was randomized. And at the end of that study, the evidence that was generated basically led to WHO's 2018 recommendations of uterotonics to prevent PPH, which included the heat-stable formulation of capitocin, which was a product of Ferring. Because of that tripartite agreement, as part of that tripartite agreement, Ferring Pharmaceuticals has now made that drug available at an affordable and sustainable price in the public sector in low-income countries like Nigeria and Kenya, And so this is something that would never have been able to happen because Ferring cannot get WHO to test their own medicine because they have a commercial interest in the medicine. So us stepping in and playing that role helped to bring this medicine closer to the bedsides of women. This is an example to me of how you need to think differently. In Nigeria now, I was at a meeting yesterday speaking to different stakeholders, and we had the health commissioner of one of the states in Nigeria who was speaking very highly about how this medicine has revolutionized outcomes of pregnant women in her. I think there's still a lot more to do in terms of public-private partnership. I think this is an area that we're not quite there yet, but I think there is some progress and we continue to push.
Amazing. Amazing. I'm just like, my heart is just so full just listening to that because, believe it or not, just today I was reviewing a paper that I'm collaborating with our partners in Ethiopia about the causes of maternal death because their maternal mortality rate is pretty high in northern Ethiopia. And one of the top causes of maternal mortality is postpartum hemorrhage. And this kind of innovation is just, like you say, transformational if we are going to reduce that mortality rate. So makes me really happy to see this as an example of what your organization is doing with partnership with large organizations like the WHO. It's an industry. Rashmi, your organization, Healthcare MN, creates platforms for networking and collaboration between various stakeholders across the health sector. What advice do you have for looking to partner with investors, academic institutions, governments, and healthcare systems to drive meaningful change? And I can give myself as an example to you because we have a few innovative projects we're working on, like the one that Madeline mentioned. And how can people like myself who are innovating in this area but are still very young and haven't gotten to the point of manufacturing products and all of that benefit from your organization?
Definitely, and that's such an important question, Rahel, right? I think, and we often talk about these issues with the founders that we interact with. I think first one I would say is, which might not be in your case because you already are in the research field, so you might be maybe by past the stage one, but know your value proposition. That's the first thing, right? Know what you are doing, why you are doing it. Is there another product out there in the market, another app out there in the market that's already solving that challenge? Why are you unique? Because once you believe in yourself, your solution, that is when you can talk with others. So knowing your why, knowing whether the solution you have is going to be sustainable in the future, and why would somebody invest in it? So that's my number one. I think the next piece is the most important piece then is networking. And that's where entrepreneur support organization like ours come in picture. Different cities have different organizations like us. We focus heavily on the healthcare side. There are other organizations even in Minnesota doing the same thing, right? We try to do events where we connect you with different collaborators and cross-sector partners. So come to these events, attend webinars that a lot of others are hosting, just learn your industry, get more knowledge on things, and then meet people. You never know who might be your next co-founder. You never know, somebody might be interested in investing in you. So we did the funders and founders event last year, and then we're doing it again in May. That is where we connected. We had a pitch event, and then we invited investors who are investing in this area in the same room. So now they can directly hear from the pitches. So that's where like these meaningful connections happen. So that is my advice number two. I would also say that healthcare is a dynamic field. So always keeping a tab on the regulatory landscape, where are the policies changing, reimbursements and all, like having knowledge on those specific to your area of innovation would be helpful when you are going and talking to an investor, or going or talking and networking with other people. And one more is, I think my journey in healthcare began with my PhD in health geoinformatics. So I am a data and research person. Nobody gets harmed by that. So more research, more data to back up your claims, how you can support what you are saying will always go a long way. And the last thing I think I'll add is, this is not a sprint. So just be prepared for a long haul. It takes time. There are a lot of organizations out there who really want to help you. It's just about making those connections. When you come to our events, maybe we are hosting one where we are bringing people who'll invest in your idea. Maybe we are just bringing industry knowledge. Maybe we're giving you a platform to pitch your idea to other people. Just come there. Don't be too much worried about setbacks. Initially there are a lot, but like, this is a long journey, so just stay consistent and small celebrate your small wins. That's what we do at Healthcare MN, and keep going.
Awesome. I'm very grateful for you guys for being here, doing what you do.
Thank you.
It's really important. And Madeline, last but not least, you get the last question of the day. I can't believe we're almost done. So Madeline, what role do you see women playing in driving innovation that's inclusive and sustainable? I mean, you've mentioned inclusivity and sustainability already. And how can their contribution be better recognized or supported in your mind?
Yeah, another very important question. I think to me, what jumps out as like women innovators is, of course, it's important to have women and just a diverse group of people kind of on the ground floor doing the innovative work, kind of like we talked about already with the project I worked on. Having an innovative team or having a diverse team helps with the brainstorming and the idea generation. But what I really think is actually a more important driving force for that is a bit of what I spoke on in the first answer to the first question, is having women and diverse leaders in the room where we're having conversations about, most importantly, funding, right? And that's kind of what we've been talking about a little bit already, is like, how are you going to merge things and like have your business proposition and have your business case and things brought to actually being supported financially? And I think really, especially kind of coming from a more corporate setting, it's so incredibly important to have female leaders in the room being able to advocate for these projects and advocate for these choices, right? Because ultimately, the women are being impacted, and so they should be a part of making the decision. They should be a part of those who are choosing what companies we acquire, what projects we follow through on, and where we're putting our money and how we're supporting not only our current customer base, our current patient base, but how are we supporting new people and people that we're maybe not adequately supporting right now? And how do we widen that? And the only way we can have those conversations is by having diverse perspectives in those important decision-making conversations. And I think that's also a great way to recognize the success and the contributions of women on your teams, right? Is by promoting them and bringing them into those conversations and showing them through action that I value your opinion. I want to hear what you have to say. I want to hear what your thoughts are on this topic, right? I think that is a really, really phenomenal way that current leadership can show women that they really truly care and they really want to make innovations in this space.
Fantastic. And you bring a good point, which is also, that also brings the point of creating the pipeline for those women to be in a position of leadership, right? Like we have heard, we need all kinds of brains to do innovation, right? We need everybody. It's not just women in STEM or, like we need a lot of different types of brains in the room. How do we support the growth and capacity of women to be in those positions, in those leadership positions? How do we invest in women's leadership as well? You know, there are organizations that are doing an incredible job with that right now. And I was a beneficiary of one of those Women Lift leadership training program, but there are others as well. So you make a really good point of starting early, you know, high school and above,
Yeah.
college, universities, graduate school, and all the way up, how we bring those people up. So investing in those kind of things can be really critical as well. Wow,
Absolutely.
you guys have been incredible, amazing conversation. I could talk to you for another hour, but we're coming to the end, and I'm looking here to see if we have our audience. I hope our audience was very engaged in this conversation and looking to see what questions you may have. Feel free to put them in the Q&A. I see one here that's already kind of posted for us. It says AI is a huge new innovation in so many industries, including healthcare. How do you panelists see AI's impact in your specific fields? Now, I know Yaduni, just knowing that you collaborate with MDoc, which was founded by one of my dearest medical school colleagues, um, Dr. Nakamobison, and they're big partners of yours, and they heavily rely on AI for some of the work that they're doing. Do you have some comments on the role of AI in the areas that you're working in?
Yeah, sure. I think that AI is, the potential for AI is huge, whether it's with regard to educating women, helping to answer questions, leveraging AI so that it can support women with helping, questions that they have around their health. I think that it's very useful with clinical decisioning to help practitioners when they're delivering care. I think, just even collecting all the data and perspectives of women and being able to synthesize very quickly what is happening has helped. But very specifically, MDoc is one of our collaborators. We're working with MDoc in Nigeria on a project that involves engaging women. MDoc provides different touch points for women, one of which is the Complete Health app that engages women and supports women with chronic conditions to have especially women with chronic conditions to have successful pregnancies. And so women are asking questions around, what sort of food should I eat? This is what is happening. This is what my blood pressure was. How do I react to that? And you must realize that they initially started with coaches, but how many women can coach see? And so being able to leverage AI to answer and respond to the women, they've designed an AI chatbot that has a persona that can speak in the local language of the women, that can engage the women and speak to the women and answer their questions. And they've actually done some research to show that women find the AI chatbot more compassionate, more competent in terms of the feedback that they get. Almost on all the scores, I think it was all the scores, and they had 4 dimensions that women rated, and blind rated the AI chatbot higher and better than healthcare workers. Now, this has significant implications in a country like Nigeria, where we're struggling with human resource for health, UK, same as nurses. And so the ratio of doctors to patients is very low, bridging that gap that we have in terms of healthcare workers. That's just one example of how AI is changing immense potential. I think that we need to feed the AI machine with more data about people from sub-Saharan Africa, so it's not responding to us based on data of people of from another race. I think that's our responsibility to build that. But I think there's huge potential for AI in healthcare, in women's health especially.
Amazing. I mean, the idea that AI can be more compassionate than humans is just incredible. I mean, we were just listening to a story on New York Times Daily about AI boyfriends, for example, where women found the AI to be more understanding, compassionate than human beings. So the potential to build something that is responsive, compassionate, and knowledgeable using the population, appropriate for that population, which is really important, what you just mentioned, that's culturally appropriate, is huge. And it's really exciting that you are already at the forefront of using this technology to serve communities there. We can learn a lot from these innovations in the West, actually. There's another question. The question, the person says, a few of you have beautifully spoken about the need for diverse voices. It's important to have this, and that are there any strategies you would offer for fostering an internal environment that appreciates this ideas? How can we ensure our organization's leadership to realize the importance of including diverse voices? So Madeline, I'm going to just bring this to you just because you spoke beautifully about the importance of diverse voices. I know during our work together, one of the beautiful things we did was to bring the voices of the surgeons in Ethiopia, who are our partners in this innovation, about their experience using some of the old archaic tools that are not safe, that are difficult to use, and then having used the newer tools in the West and seeing the advantage of that, they helped us create ways that we can combine the two. And that's, I think that has been one of the greatest advantage of working in this diverse environment. So what do you say? Do you have any suggestions for institutional support for this kind of work?
Yeah, absolutely. So I think to me, what has jumped out through my experience with bringing diverse voices into the innovation space is really just trying to be open and honest about what's going on and kind of what your experiences are. So I think specifically kind of one thing that jumps to mind right away for me is working as a female engineer in a mostly male dominated space. A lot of the times I have found great success in just approaching people with a very open, honest, genuine perspective, and kind of talking about the things that a lot of people don't really want to talk about and challenging things. I've found most of my colleagues and most of my leadership are usually very, very open to and interested in challenges as long as you are bringing it to them in a way that is open and honest and vulnerable, right? So I will go to my leadership and say, hey, we just hired these folks and I noticed that it's not a very diverse crew. Like, what kind of can we talk about that? And they'll be open to having that conversation as long as you approach it in a way that is vulnerable and open to listening. And I've found great success with that. I think that's kind of another thing that kind of gets at the project and bringing in the doctors from around the world to discuss with them, right? Like, if we had gone into that conversation thinking we as the project group knew the answers, right? That's not leading to a very conducive conversation, and it's not really going to get us anywhere. So I think really it's about bringing vulnerability to these spaces and bringing openness and being able to listen and being really, really open to not having an opinion, even at the start of these conversations, right? And I think that sets you up for success, both in a corporate structural females in the workplace, diversity in the workplace setting, and also in just a collaboration on project setting, right? Is how can I really truly listen to the answer of the question I'm asking and kind of approaching it from that angle,
Yeah.
if that makes sense.
Yeah, very, very, very well said, Madeline. Really appreciate that. And of course, like creating safe spaces for people to be themselves and open is really important as well, I would say. And sometimes that requires building trust ahead of time, right? Like people have to know you and have to really believe your intentions. And it might take a while before they feel like you have the right to say the things that you're saying, Madeline. So
Right.
somebody who just walks in or hasn't really shown their integrity ahead of time may not be able to be empowered to do what you're saying. So those are things that are also really important. There's a few other questions coming through. This one I'm going to direct to you, Rashmi. What are some successful models for engaging women as co-creators of health solutions rather than just recipients?
Wonderful. I think, storytelling helps in cases like that. I think we need to highlight the successful stories of women who are already co-creating, creating new innovations, new ideas, bringing them to life. So there are platforms across country. Here in Minnesota, there are organizations like Let's Talk Women. There is Her Self Health. These are just focused on bringing these women voices out. When more people hear more women talking, I think they get these ideas of engaging them more. So success stories, sharing success stories, I think is a big factor that will help going forward. Sometimes it just comes naturally. Like earlier on, I was talking about that forum that we had, the panel, when we were looking for women experts in the area. But it's not that there are not enough women who are working in the field. Women naturally tend to not say yes to these opportunities when they are given to them. So I think that mind shift is necessary. And once we bring more women on the table, we will start seeing that women are not just recipients, but they are co-creators. They actually already are, but yes, we can have more of them.
Yeah. Wonderful. Yeah, we're very fortunate here actually in Minnesota that we have quite a few
Agreed.
organizations that are really trying to do this. And so continuing to learn from each other and replicating the things that are working is really important, I think. Um, this question is for you, Yaduni. You might be better positioned to answer this. How do you do good global health collaborations for women's health innovation? So that, for example, the US isn't overpowering other country ideas or vice versa?
Thank you for that question. I think that's very relevant. And I think that's what we were really trying to do with the Strengthening Systems for Safer Childbirth initiative, was to bring the problem solving, the innovation closer to the source, closer to the issue. I think it's Norman Vincent Peale that says that every problem has in it the seeds of its solution. And so imagine the problems that you have in sub-Saharan Africa. And just as you have that many problems, you have that many young people who are thinking innovatively and coming up with really brilliant ideas to solve this problem. And so it's important that we begin to recognize the value of proximity to the issue. Technical expertise does not trump proximity to the issue. It's what we call native intelligence in Nigeria. And it's just really a knowing, it's an awareness, it's a reasoning and a capacity to derive insights just from being situated in the mess, just from living day and night in the issues that you're solving for. It's an understanding of the way that people in that context respond to anything. It's not the stuff that you can learn in a book. And so encouraging that creativity and leaning into the native intelligence of the people around and encouraging that helps. There is a value that the technical experts bring, but like you said, everybody needs to be at the table. I think another thing is listening to women, because if we're solving for women, women have to be at the center. We call it design thinking, we call it human-centered design. They say go out of the building. And that's really just, engage with the women, engage with the communities that support these women, understand the issues from her perspective, from the community that she lives in, and let that be the starting point of your solving. In identifying the issue, you engage with the woman. In crafting the solution, you engage with the woman. In testing the solution, you engage with the woman, and you iterate, because you can keep improving. Just constantly iterating is critical. And then thinking interdependently, collaboratively. I know that Rashmi mentioned something about, who has designed stuff, what can you, how can you complement their solution? It's a skill to take the thinking of other people and layer on your own thinking, or extend their work by thinking, I don't need to solve for this. This is solved for. How do I then extend and build that way? If we're thinking interdependently, we will get a lot farther. We'll be able to value each other's perspectives at the table because of the diversity in our thinking. So I think if you hold these principles high as you engage with other people, then you will. I think increasingly, a lot of people are recognizing that a lot of Africans can solve their problems. They just need to be supported through that to figure out how to do it. And they're scrappier. Their solutions are way cheaper than the shiny the shiny things, because people learn to innovate within what is available to them. So they're not going to go for terribly expensive things. So I think it's a mindset that is gradually shifting. I think there's more that can be done. And I think that by engaging people who are proximate to the solution, we will get there.
That is very well said, Yaduni. And, it reminds me of my favorite quote by an Australian Aboriginal leader, Lila Watson, who said, if you've come to help me, you're wasting your time. But if you've come because your liberation is bound up with mine, then let's work together. And that's that idea of, what collaboration should be like, is because all of our well-being is interconnected. And so we're not going to help or fix someone else's problem or vice versa. I think that's really critical to this thinking. I also think that I value the experience and proximity to the problems and the innovative things that the local communities can come up with, and they have so many assets. There's also something to be said to bring a different perspective. For example, like when there's global partnership, where we've seen things done a certain way in the West. So we've seen what kind of innovations are possible. And then we see how those innovations could be changed to solve a problem. So you need both sides, that knowledge that certain innovations do actually exist. And how can we modify them? Kind of the example of what Madeline was talking about. So we need each other. It's not just one or the other. It's kind of like those different brains. With that, there is one question about what innovations are you really excited about? I think you guys kind of mentioned that already. Rashmi, you gave some examples, and so did you, Yaduni. So I'm probably going to skip that one here in the interest of time. There is a question about the importance of communicating value proposition, and that women's health has been historically underfunded. How do we encourage more funding for women's health initiatives? And is this part of the challenge? Is it not communicating the value proposition clearly? Or are there other dynamics at play? And I was going to have you respond to this, Rashmi, in terms of this question.
I have to say, this is something, if I have to rank the problems we are facing and the issues and challenges, funding is number one, right on the top, right? There are so many innovative ideas. How many are getting funded? That's that's the issue. And that's, I think, the biggest challenge we are trying to focus on as Healthcare Minnesota, how we can bring more funds from across the country, even within the US. I'm not even going global. We are just talking about one state, and that how it has less funding compared to some other states here. So to going back to why these challenges exist, and then there is like the value proposition piece, right? So the challenges are two things. I think if my stats are right, in US, around 10% investors are women, and then of the total innovators or innovations that are happening, only 2% are women innovators, women founders. So that kind of speaks to why there is less funding in the women health space. So if there is a group of investors who's going to invest on something, and it is something that is very specific related to health issues that only affect women, we need more women sitting at the top level deciding, making those decisions, right? That's why we see less investments, because oftentimes these are solutions that are just catering specific to women audience, and there is not enough voices in the investor side to say, yes, we need it, why this is
Yeah.
important. So that's where the failure happens. That's one piece. When it comes to value proposition, I necessarily don't believe that all women don't know what their value proposition is, but we need to be more bold. We need to be, we need to say that yes, there is value in this idea, like men are. So there is this slight, slight difference that I see. Just having that conviction in the idea you have, I would say just go all out, just be more bold about what value proposition you bring to the table. There always will be that challenge, which is a bigger challenge that not in our hands to solve. We can just contribute a little bit in ways we are trying to solve those issues, in bringing more funding, at least for Minnesota homegrown innovations from outside, bringing more people on the table, highlighting like women specific events where we only talk about, women innovations, and we know investors who are only interested in investing in the femtech side of thing, maybe connecting them somehow. So we are doing our bit. That's a bigger challenge to solve, but it'll take time. Definitely seeing progress.
Right. Thank you so much. I really appreciate your perspective on that. That was a really good question. There's one last question, and anyone can answer this one. It's about concerns about AI, about the negative consequences of AI, and whether or not it could be biased or problematic, and can be used in a negative way. So, Madeline, I see that you changed your mute button, so maybe you're gonna give this a shot.
I'll give it a go. I'll give it a go. Yeah.
Go for it.
I think an interesting answer to this question is it's a little fuzzy on how to make it like safe, because I think safe AI is an interesting challenge in and of its own, but at least in terms of making it non-biased, I think that is a role that is something that academia can play a really interesting role in. And when we kind of think about how do we make, like, it's even just a big problem outside of just AI, but just any software in general. How do you make software unbiased? I think a really interesting thing we can think about is as the world as industry has become a more diverse space, and as more more diverse young people have gotten opportunities to come up through at least the American education system, I think that is what sets academia up for success in terms of providing space for more diverse groups to work on these kind of projects, right? So how can we have academic spaces contribute to working on these AI projects, and how we can make more diverse teams contribute to AI projects in a way that helps prevent some of that diversity, or not prevent diversity, goodness, prevent some of that bias.
Yeah.
um so yeah, I think kind of an answer to that, really the root of the answer is how can we We need people developing these AI products, and we need teams developing these AI solutions to be just as diverse as any other innovative team, any other group doing innovations. They need to be diverse, and that is how we help prevent bias written into code, just like we do in any other setting.
Mm. And thank you for that, Madeline. And Rashmi, I see that you wanted to say a few words on that too.
Yeah, I just wanted to do a quick plug-in. This is such an important topic, right? We last 3 years we have been doing a AI in healthcare forum, and that is the platform where we talk about these issues. So this year we are hosting again in July. So that's my plug for the event. It's called AI in Healthcare Forum. So because this is like specifically we are talking about AI in healthcare, what we do with that forum is one piece is showcasing local startups who are working in this space. We invite them, have them talk about their ideas, what they are working on, and the next hour we dive into some breakout rooms where we talk on different topics in AI and healthcare. So interestingly, last year our keynote was on bias and ethics. So that is a space where if somebody who's interested should come plug in, hear these speakers talk about last year's breakouts were how AI was used in hospitals and healthcare settings. So we had speakers from Mayo and Atlanta Health come talk about that. There was one room AI in medical devices, and then there was another room on AI and entrepreneurship. So we are still working on the details on that, but that would be a place where I would like to invite all of you, if you are local, please come and join us. And these are the very conversations we'll have in that forum.
Fantastic. Wow, that's wonderful. I hope that person who asked that question will join you in your upcoming AI. Is that a live event?
It's a in-person only event.
Yeah.
For
Okay.
now, yeah.
Perfect. So with that, I am going to wrap up this event. It was fantastic talking to you. I want to thank our panelists for this insightful conversation. It's been a wonderful conversation that we've had, and hope we will continue to have to talk to each other. And I want to thank everybody who made the time to attend this event. We really appreciate you and your wonderful questions. I can see everyone was very engaged. We're going to put a post-event survey in the chat that we would appreciate if you fill it out. I know quite a few people have already left the meeting, so we will also be sending a follow-up email with a link to the survey for those of you who didn't get opportunity to fill this out. If you'd like to learn more about our Center for Global Health and Social Responsibility and our Global Women's Health Initiative, visit our website at the link shown here. But we would also invite you to sign up for our newsletter to stay in touch and to learn more about future events that are coming up. And if you believe in our mission and want to support some of the initiatives I briefly mentioned at the beginning and other initiatives we're doing, please consider donating to our Global Women's Health Initiative at the link here, but also you can find the link on our website. And finally, before we wrap up, we're excited to invite you to another women's health event in person on April 20th. That would be hosted by the Rotary Club, where I will actually be speaking about global maternal health in the context of the various initiatives of our center. This will be a fantastic opportunity to connect with us in person and learn about our programs and to engage with other supporters of global women's health. You can find the link to register in the chat and on our IWD event page as well. We would love to have you there. Thank you again for joining us, and I hope you all have a great rest of your day. Thank you.